Hi, I'm Helen Jacobs, and I'm here today as representing the Senior Center, the Redwood Coast Senior Center in Fort Bragg. So I'm so grateful also to be here. I have and am aging in place. I've been living on the coast since I was in my early 20s, so many of you I have watched you grow up as you've watched me grow up. And here we are. Now we're old. Which is a bit of a shock, but true. And the Senior Center is just an amazing place because it provides a community, a sense of community. As Teresa and Susan were both saying, isolation is just one of the worst things that can happen for people. And loneliness, isolation, which happen because of disability sometimes. You know, not necessarily because of choice, but because a person can't drive anymore from Little River to Fort Bragg, or can't get out, can't get their lunches. That isolation starts to increase depression and some of the dangerous things that can happen for people. So the Senior Center, you know, tries to act as an antidote to that in many ways. Last year it served approximately 55,000 lunches. The congregate lunch, which is served every 5 days a week, is a meal where people can come and socialize and sit and have a good lunch, which for many people becomes their dinner as well because they have enough food to take home. And it's a way to hang out with people. Meals on Wheels are sent out 3 days a week with a frozen meal for the off days. And I think a few hundred of those go out every week. And then 2 days a week there's what they call the Out the Door program, where somebody who doesn't want to come into the center but comes and picks up a hot meal to take home. As most of you probably know, some of our funding is at risk. The contract that we have with the Area Agency on Aging has been passed by the by the Senate, but it still needs to be passed through the House of Representatives. So at the moment, our funding is guaranteed through September, but not after. So that will be just something to pay attention to as you read the news.
Helen, a little louder, please.
Okay. Some of the other programs that the Senior Center provides is a bus service, transportation, 5 days a week, which goes from Fort Bragg to Gibney Lane, north to Cleone, and 4 miles to the east. There's the Adult Day Program, which provides respite for caregivers and social activities for people with dementia. We have outreach workers that help people with applications for CalFresh and HEAP, also programs that are currently at risk. We have a fabulous thrift store. I'm currently running a peer counseling program where help people learn how to listen to people, and then they go do home visits, and a number of you are here today. Thank you.
Raise your hands if you've been a peer counselor or have been a peer counselor. Yes. Great.
So we have, and we have peer counselors. We have the Friendly Visitor Program, which is also an amazing program where people can go and do social activities with people in their homes. And then there are chair exercises and social programs such as ping pong, knitting, poetry, ukulele, quilting, and bridge. So come up to the Senior Center, 490 North Harold Street, and come talk to me about any of our programs during the break.
Hey everybody, my name is Anya and I'm with Cancer Resource Centers of Mendocino County. Cancer Resource Centers is a local nonprofit that was started we're celebrating our 30th anniversary this year. It was started by a local woman who had cancer herself, Sarah O'Donnell. She lives in Compchi still, and after her own experience of going through cancer and just not having any resources or support, she realized how essential it was to have something in the community that where people could come and get information about resources and receive support. So we support anyone, anywhere in Mendocino County with any type of cancer, any stage of cancer. My favorite thing about our services is that they're all free. And we have an office in Fort Bragg. We also have an office in Ukiah. We have 5 patient navigators, which I'll probably talk about a little more later what they do, but 3 of them are bilingual. And then on the coast, we help a lot with transportation because that's a really significant need here. So you may or may not be aware that, like, if someone needs radiation, they have to travel all the way to Ukiah for that, and it could be 5 days a week for 6 weeks in a row. A lot of people don't have access to transportation or family or friends who can take them. So we hook people up with resources, whether that's helping them sign up for transportation through partnership or finding volunteers to drive them to Ukiah. So that's a big service that we support people with here on the coast, but we also have free boutiques in both of our offices with bras, wigs, prostheses, things like that. We have lending libraries in both of our offices. We do peer matching, so, you know, if someone is wanting to connect with another person who was in a similar situation as them, we can potentially find someone just so that you can talk to someone else who's been in a similar situation and hopefully not feel so alone. So yeah, our patient navigation, like I said, is kind of the heart of what we do, and I'll say more about that, but it's the 5 individuals who work really closely with all of our clients to help them prepare for their appointments and go with them to their appointments if they want, take notes and make recordings so that people can listen to the recordings afterwards and have something really concrete to look at that gives them all of the information that was discussed in the appointment and next steps and who to connect with as far as their doctors and upcoming appointments and their diagnosis and things like that. So I think I'll leave it at that for now and say more later, but thank you all for being here.
My name is Robin Serrahn, and I am the hospice physician on the coast. We've had a Medicare hospice now on the coast since July. What that means is that there's a team of basically 4 people. The hub is the nurse who does all the work, and then myself, I get to sign all the good prescriptions. And we also have a social worker and a chaplain. That's the team. And what Medicare hospice does is, well, the goal is to provide comfort so people can die at home. And the goal is not to prolong life. The goal is comfort. So it is very binary, and decisions are based upon that. What else should I say? Oh.
Well, what's happening right now?
What's happening right now?
There's a
Thank
waiting
you.
list, we're hearing all this stuff,
Yes.
and we don't have any
Yes.
concrete information, so
Yes.
you're here.
So we're limited by nursing staff. We can have currently about 12 patients, which we have, and sometimes we go over that. However, we have 10 patients on the waiting list. So we need another nurse, and that's where the community could help us. We need another nurse. That's what's keeping us, limiting our census to 12. And that's the short of it. And I'll certainly
What
answer.
about home health, palliative care? Can you speak to that?
Sure. So I can. There is a continuum from palliative care, which is symptom-based treatment to reduce symptoms.
Like pain?
Like pain, I would say even loneliness, anxiety, fear of death, all the things that folks have mentioned. There is a continuum from palliative care to hospice. However, the way we call it the medical industrial complex, someone said, has carved out a niche for hospice that is not palliative care. So that's a whole separate program. So even though there's a continuum that would make sense, there's like this very hard line. So,
And that hard line is what, and how is it determined?
well, it's determined by what the patient wants. I mean, this is one of the few times that patients have a certain agency, sometimes choices between two bad choices, but they get to choose. And whether they want to, continue to prolong their life doing chemotherapy, which is not hospice, or if they want to say, well, I've had enough, I don't want to do this anymore, this is not working, then they would go to hospice. And that involves a discussion, which often doesn't happen, because of fear. I used to work in the emergency room, as maybe some of you know.
Yeah, how many people have seen Dr. Serrahn in the emergency room?
Wow.
Yeah.
Yeah. Oftentimes people would come at the end of their life and they haven't really asked the question, well, what do I want, going forward? Do I want to prolong my life? And that also would involve a certain amount of suffering, or do I want to just be kept comfortable and not be alone, which cannot be underestimated. So that's what we do. And it's going really well. We have a really dedicated team. The nurses are phenomenal. The social workers phenomenal. They deal with a lot of these questions that were brought up earlier. And it's going very well. We just need another nurse because, as we know, we have an elderly demographic, and we want to serve those folks.
Is the need for the nurse because you need funding to fund this, or you
No.
need funding and you need
We just need a nurse.
It's a volunteer position.
It's
No.
not a volunteer.
No,
It's a
it's paid.
paid position. And
Use the mic.
things. The funding is not the issue.
Yes.
Medicare hospice pays for itself. And I should also add that what we offer in terms of services, like we pay for all the medications, we pay for, of course, the nursing staff and myself and the social worker and the chaplain. But if you need a bed or any kind of medical device, oxygen, we pay for it all. And then at that point, the purpose is to die at home and not to go to the hospital. But we will keep you comfortable at home.
Hi, my name is Mark Apfel. I'm a family physician. Please ignore this. This is not just what I do. So I've been a primary care doctor in the Anderson Valley for the past 49 years, and that's been my passion. Listening to some of this, one of the things I always did as a primary care doctor was I always had advanced care planning conversations with my patients, which most people don't have. And I started off with people when they were 18. And people say, why do you start off with such young people? And if you look at our legal cases for advanced care planning, the three most important legal cases were all young women in their 20s who had catastrophic events and didn't have any advanced care planning, and their cases ended up in courts for 10, 15 years. In 2007, I got involved with introducing Pulse into California. I was one of the physician leaders who helped introduce this and helped write it. And I was one of the co-physician leaders for the state for 15 years on this, so I'm probably the content expert on this form. So if people have questions about it, I will be glad to try and fill them in and answer that. Because of my work in Pulse, I started getting involved with palliative care, and I became board certified in palliative care. And palliative care is really, it's specialized medical care provided by a team of providers, just as Robin was describing hospice. It's the same type of care, but it's for people not necessarily who are dying. I mean, we have very good data that if you have cancer and you're going through chemo or radiation and you get palliative care, you have much better outcomes than people who don't get palliative care. Unfortunately, as Robin was saying, Medicare does have a hospice benefit, but there is no Medicare palliative care benefit. So there's no way to really pay for this through Medicare just as individuals. So it's very hard to deliver this in the community. We are lucky in that our local Medi-Cal team, Partnership Health, it does have a palliative care benefit, and they do provide palliative care. There's a group in Ukiah called Madrone Care who does provide palliative care for Medi-Cal patients. So that is something that people should know about. Lastly, since we passed the End-of-Life Option Act in California in 2016, I have been doing what we call medical aid and dying for the past 10 years. I do this all around the county, and I also do palliative care all around the county because I believe I'm the only board-certified palliative care doctor who's actually practicing in the county. And what I do with people is pretty much everybody I see, I go to their homes and see them, and I travel to them and I see them and I take care of them at home. And it's very rewarding work, and people are really grateful to have this. And I'll talk about that more later. Okay? Thank you.
Thank you, Mark, for all that you do.
Hello, good morning. Thanks for having me. I'm Seth Ferguson, the funeral director at Chapel by the Sea. Chapel by the Sea, if you don't know, burned down in 2021. It's been rebuilt, and I've been there through the rebuild, and then now it's been rebuilt for a couple of years. My primary role in the community, along up and down the coast, pretty much the Sea Ranch over to the Leggett area, is assisting our community and their families when someone passes away, from before the time of death, and then after. I think it's a really hard time for a lot of people, obviously, but it's also a really powerful thing to have, an active funeral home in the community. It's almost a spiritual thing even. I get to work with these two quite often, the two doctors seated here, and kind of what I do at the chapel is preparation of the deceased, for whatever services their family may want, the creation of death certificates. We'll go over that a little bit later. I'll go in some details on what you may need them for, how many you may need, and things like that. I want to talk a bit about the process of what you do when a loved one has passed away and kind of the different paths that we have on the coast. We have a very unique situation here on the Mendocino County coast on what the process is after someone passes away, depending on if they're in hospice, if they're working with Dr. Apfel, or if it's, an attendant, kind of random. So there's a little bit I want to discuss about that so everyone can feel prepared and that they know what to do if and when someone passes away, like each and every one of us will. And then I want to go into a little bit about the services that Chapel by the Sea can offer, because again, because of our unique geography, we have a lot of unique funeral abilities, from green burial to ocean burial, to some unique things we can do with cremated remains as well. And I'll just kind of go through the processes of each one and try and answer any questions people may have about how all of that works for their loved ones or themselves. So yeah, that's kind of my role, and we'll go in more depth later.
Thank you. I'm Kathryn Allegra, and it's my pleasure that I get to participate in being a facilitator in the grief group. And so obviously you would be coming to see me if you'd lost a loved one. We don't limit the grief group to only people who have lost people. If you have a companion animal and your companion animal has passed, that's also, we make people welcome to come to the grief group for what it is they're grieving. And it's a real honor to be there and have people come in and trust you or trust me enough to be able to share how they were feeling and how they felt about their loved one that they lost. And so what we do is we have every Thursday from 3 until 5, we have an open group that's available. There is no cost. You can make a donation when you're there if you like, but it's not needed. And we meet for those 2 hours every Thursday, and it's been going on for over 15 years. And I had a gentleman come in this last Thursday and said, "You're the only grief group I could find, like for very many miles around." And that, I think, is also a really important fact, because I know that there are more people who are grieving that don't come to our group than actually come. But one of the things that I love is seeing them be able to experience their grief, and not that you ever get over your loss, but you learn how to live without the person being next to you all the time. And perhaps it's just your best friend, you know. So the grief group that let me say it this way. We offer the grief group to anyone who feels that they're grieving about any particular aspect of their life, and whatever loss that they feel like they need to talk more about. And so we're there for that.
Where?
It is in the company store on 303 North Main in Fort Bragg, and we're on the very west end. And Friends of Health puts it on, but we rent a room from the